when people are only getting their blood pressure measured in a doctor's office or a clinic. What you have to remember from a scientific standpoint is that it is natural for blood pressure to increase with age, especially over the age of 65. This happens for many scientific reasons, changes that happen to the body, including loss of elasticity of the blood vessels. Blood vessels tend to stiffen. There are hormonal changes. There are changes in kidney function. And a lot of this is a natural adaptation to the process of aging. And again, I'm not suggesting that you allow the blood pressure to drift up to dangerously high levels, but the question is, should we be overly aggressive in lowering the blood pressure? I know that there are a lot of people out there, especially in an older age group, who now are running at blood pressures systolic between 100 and 120, and I believe that we're being way too aggressive in bringing the blood pressure down with 1, 2, 3, sometimes 3 or more medications. And as for younger people under the age of 50, let's say, there is a school of thought which I actually subscribe to, that nearly all cases of high blood pressure are due to insulin resistance. Not 100% of cases, but nearly all cases are due to insulin resistance. And I've made videos about insulin resistance previously, including how you test for it, blood tests like blood glucose, HbA1c, HOMA-IR. I put links to those videos down below. But we have a pandemic of insulin resistance. It's exploding across Western countries, primarily due to a poor lifestyle and a terrible diet high in ultra-processed foods, refined carbohydrates, and sugars. And insulin resistance leads to high blood pressure through a number of mechanisms, including impaired vasodilation, increased sympathetic nervous system activity, renal sodium retention, endothelial dysfunction, and activation of the renin-angiotensin-aldosterone system. But those are all very technical terms, which we can certainly save for another video. So what would be my advice then if you are diagnosed with high blood pressure and you're on medications, or your doctor is thinking of putting you on medications? Well, first and foremost, as I just said, because so many cases are caused by insulin resistance, I would advise you to aggressively work on insulin resistance management through whatever lifestyle factors you can. Because most people out there, when they work on this and succeed, their need for blood pressure medications is greatly reduced. I've seen many people completely come off their blood pressure pills once they have successfully fixed their insulin resistance. So aside from that, and again, I'm not suggesting that you stop your pills or you do this without medical supervision, because many people, their blood pressures are very high and they are on blood pressure pills for a reason. But I would suggest that you get a home blood pressure machine. If you haven't purchased one already, they are very useful. And what I'd advise is that you measure your blood pressure for a couple of weeks, at least 3 times a day, in the morning, afternoon, and evening. You keep a record of your blood pressures, and then when you next go back to your doctor's office, make sure that when they measure your blood pressure in the clinic, also have your home machine with you to make sure that the two correlate, that your home blood pressure machine is actually showing the same reading that the blood pressure machine in the clinic is showing, because some of these home blood pressure machines are not even accurate. So you want to do that. And then once you have recordings of your blood pressure at home, you can go through them with your doctor, hopefully a trusted doctor, to see if any changes need to be made. And what I find is that there are a lot of people who will find that they are on blood pressure pills, 1, 2, 3, however many blood pressure pills, and they're regularly checking their blood pressure at home, and they're frequently getting systolic readings, that's the top number, between 100 to 120, which I believe is on the lower side. And particularly as one ages, this starts to cause a problem. Many people can start to feel weak, they can start to feel dizzy, many people can have fainting episodes, elderly people can fall, and many times it's because their blood pressure has dropped. So what I would encourage you to do, if you find that you're on blood pressure pills and your blood pressure readings at home are on the lower side, then go through this with your doctor and see if you can successfully wean yourself down from any of those medications. That would be my advice. But first and foremost, for most people out there, work on that insulin resistance. If you do that successfully, so many people out there can come off their blood pressure pills completely, which is a real win. Why do you want to be on blood pressure pills or any medication if you don't need to? Thanks everyone for watching.